So thanks to everybody for coming. Today we're going to talk about sentence structure, word choice, and punctuation. And I'm going to try and keep you from falling asleep. So I added a little art and music to make it a little more interesting. We'll also talk about writing a manuscript title. That is a very important thing to learn about because that's the first impression of the reader often. Also talk about how to access certain resources for the revision stage of writing your manuscript, and then we'll talk about plagiarism. And there are certain types of plagiarism that people don't think about, so I'm going to bring those up. I'll start out with a little bit of art, and I'll show you where we're coming from here. You're probably familiar with the artist M.C. Escher, and this piece of art is called Crab Cannon, and he made this piece because in tribute to a piece of music written by Johann Sebastian Bach, which is called the Crab Cannon. And the first thing I'll be talking about today is sentence structure. And what I love about the English language is that you can structure a sentence in a way that the word order in this direction means one thing, and you can use the same exact words and flip them in a different direction, and it has a different meaning. So the reason I'm bringing this up, it might be a little confusing at first, why am I bringing in art and music, but this piece of art and this piece of music I'm going to show you remind me of that, the fun that you can have with sentence structure. So we'll start with this. Now this piece is the Crab Cannon, and it's it sounds a little bit creepy. It's done on the harpsichord in minor keys, which make me think of horror music at the beginning. But what I like about it, Bach wrote this so that it could be played forward and backwards at the same time. And there was a mathematician who made a video of this to represent it and showed it in a mathematical way on a Mobius strip, which I thought was kind of cool. So. Okay. So that is a way to introduce the fun that you can have with sentence structure. And here is another example. You might be familiar with the story of Hansel and Gretel. And in that story, Hansel and Gretel, they get lost in the forest, and there's the mean witch who has the gingerbread house, right? And she locks up Hansel. She wants to eat him. And first, before she eats him, she wants to fatten him up. So he's locked in a cage, and every day she feeds him lots of sweets. And she wants to check if he's getting fatter. Now, she's nearly blind. So the way she wants to test if he's getting fatter is to have him hold out his finger through the bars of the cage, and she'll feel his finger to see if he's fattening up. So his sister Gretel tells him to use a chicken bone. She gives him a chicken bone to hold out, and every time the witch comes, he holds that out, and she thinks that he's still skinny, not ready to eat yet. So there's an author who wrote a book of children's poems in what she calls reverso verse, where she writes the poem about the fairy tale in one direction, and that means one point of view, and then she writes with the exact same words, she reverses everything, and it's a different point of view. It tells a different story. So in the first version, we have the witch's point of view. Fatten up, boy. Don't you like prime rib? Then your hostess, she will roast you, goose. Have another chocolate. Eat another piece of gingerbread. When you hold it out, your finger feels like a bone. Fatten up. Don't keep her waiting. And then you have Gretel's advice to her brother. Keep her waiting. Don't fatten up. A bone feels like your finger. When you hold it out, eat another piece of gingerbread. Have another chocolate, goose. Then your hostess, she will roast you like prime rib. Don't you fatten up, boy. Dr. Lois DeBakey wrote a very good article about sentence structure. And what she said is that grammar is not a set of unrealistic rules devised by a sadist bent on torturing school children. It's a set of principles by which language functions. Grammar keeps words straight to deliver their intended meaning clearly and efficiently. In Latin, canis mordit hominem, dog bites man, means the same as hominem mordit canis, because the word endings, not the word order, denote meaning. In English, however, and she goes on to give these examples, dog bites man doesn't mean man bites dog. A bird on the wing doesn't mean a wing on the bird. Have you left anything doesn't mean the same as have you anything left. Only I love you doesn't mean I love only you. So now I will talk about things you can do as an author in your medical writing to avoid the serious errors in sentence structure that will confuse your reader. As a writer, you want to focus on writing in a way that your readers will understand. You need to know how your readers approach sentences. The writer, as the writer, you might think a sentence sounds fine, but you have knowledge bias. You understand your topic. Your reader might not understand what you're writing. The 4 major errors that I'll focus on today are fragments, comma splices, run-on sentences, and misplaced modifiers. The first one is fragments. There are 2 kinds. A phrase, which would be missing a verb or a subject or both, and a dependent clause, which means it can't stand alone as an independent expression. Here's an example of a phrase. Everyone's sitting in the classroom. How could you fix that? Everyone is sitting in the classroom, or everyone sitting in the classroom is hungry, or however you need to add a verb there. Sitting is not a verb here. It's actually modifying everyone. It's describing everyone who is sitting. Here's an example of a dependent clause. Although the hospital contained more than 800 beds. How could you fix that? You could knock off although and just say the hospital contained more than 800 beds, or you could say, if you had more to say about it, you could say something like, although the hospital contained more than 800 beds, each patient was treated individually, or something like that. So that's fragments. Next we'll do comma splices. So we form compound and complex sentences by combining clauses. If you look at these two sentences, Lisa entered the room, she spoke to Jessica. You could combine that a few different ways that would be grammatically correct and would make sense. You could say, Lisa entered the room and she spoke to Jessica. And here, the rule is you can put a comma and a conjunction. So comma and, or you could do comma but, or whatever is appropriate in the sentence. The next thing you could do is my favorite punctuation, which since I'm an editor, I'm allowed to have a favorite punctuation, the semicolon. Lisa entered the room, she spoke to Jessica. So that's allowed and proper. And then Lisa entered the room, colon, she spoke to Jessica. All of those work. When you're combining two sentences like that, keep the image of a scale in mind. You want both parts of the sentence to have equal weight. The reader will be confused and thrown off if you have a long part in the beginning and then a shorter statement on the second half of the sentence. So you want to keep equal weight statements. The next common error, well, actually it's not that common because people are so aware of it. This is banged into your head in high school and middle school, is run-on sentences. Typically, people don't make this mistake unless they really haven't had time to revise. This is where two independent clauses are joined with no conjunction and no punctuation at all. So here's an example. Gestures are a means of communication for everyone. They are essential for the hearing impaired. How could you fix that?
Right, no opinions? Really blank here?
And, yeah. And, or
As.
but, or however,
As.
or, yeah. As.
I would have done two sentences.
Or you could do two sentences.
Period.
Sure.
They are especially essential, or they are essential for...
Right. Yeah, there's no set specific rule on how you have to fix it. You just have to fix it. So you can do it many different approaches that will make it more clear to the reader. And then the fourth example of a more serious error with sentence structure is the misplaced modifier. Now I'm going to show you one sentence. I'm not going to change the words, but I'm going to change the order just a little bit and watch how the meaning of the sentence changes. Only you will need to plant one package of seed. So that means what? Only you, not anybody else,
You're
right?
the only human being in the planet
Exactly.
that can do this.
Right. You will only need to plant one package of seed. That's all you have to do. You don't have any other needs or things you have to do. You will need only to plant one package of seed. In other words, you don't have to water the plant or do anything else. You will need to plant only one package of seed, not 2 or 3 packages, right?
Now, we could argue that 2 and 4 are almost the same meaning, though. Don't you think? You would only need to plant one package of seed. I would interpret that, yeah, I only have to do one package.
Mm-hmm.
In a way, 2 and 4 are kind of, we could argue, may not be dramatically different.
They're similar, but it is a subtle difference. But they are different because you only need to plant one package of seed is focusing on the verb here. the planting, whereas you will need to plant only one package of seed. Your emphasis is on the one package of seed. So it's a subtle difference, but it does change the meaning slightly. Okay, so now let's practice. These are some examples that Dr. Lois DeBakey has in her article, which I thought were kind of fun. She was good at picking out embarrassing examples.
She's a bear on misplaced modifiers. She can find them everywhere.
That's funny.
Being moribund, the doctor could do nothing for the patient. How could we fix that?
Doctor could do nothing for the moribund patient.
Sure, that works. It's not the doctor who's in that state, right? But that's the way it sounds. The patient was first seen at the city jail where he was being held because of high fever. How could you fix that?
It's first seen for high fever. It was seen for high fever at the city jail.
The patient with a high fever was first seen at the city jail. You could
For high fever.
Where do you think?
Put a semicolon.
or use a semicolon.
Right after that jail.
Yay. The patient was referred to a psychiatrist with a severe emotional problem. That's not going to help the patient very much, right? Maybe the patient with a severe emotional problem was referred to a psychiatrist.
Could you also say the patient was referred to a psychiatrist for a severe?
Sure. Yeah, so again, there's no one way to fix these sentences, but you just have to look at how what the modifier is emphasizing, and we'll get into that a little bit more in some future slides, how just changing word order a little bit can subtly change the meaning. Okay. So now we're going to move to another section about choosing the right word. And I know you've heard this probably a million times, affect, effect, but we're going to talk about it anyway because it's still something I come across a lot, and it's just a common mistake. It's confusing. Why are these two words so confusing? Because they can both be used as either a noun or a verb. That's why they're confusing. So effect is most commonly used as a noun. It means result or outcome. When used as a verb, it means to bring about or to cause. So here are some examples. What will be the effect of this drug on the metabolism of pyrimidine? And then if you want to use it as a verb, here's an example. We would like to effect a change in the treatment of diabetes. Now the word affect is generally used as a verb, and when used in this way, it means to have an influence on something, to produce an effect on something, just to confuse you a little. The mechanistic defects that affect in vivo transcription are not well understood. Now, if you're using affect as a noun, you pronounce it differently. It would be affect. And it's most common in psychology or psychiatry. The patient showed inappropriate affect by laughing at his wife's funeral.
So these are really two different words. They happen to have the same spelling, but the
Right.
words are really two different words.
Yeah, but you can see why it's so confusing.
Yeah.
And it's a common mistake. You know, you might think you have this figured out, but when you're writing, it's easy to slip up. Okay, we're going to move on to another example of where choosing the right word can affect the tone of your manuscript. Now, this is advice that we get from the AMA Style Guide and also from the American Medical Writers Association, and it's about trying not to dehumanize your patient. So cases versus patients. A case is an instance of a disease or disorder. A patient is a person who is receiving medical care. And I'm just going to walk through the AMA manual's guidelines on using these terms. A case is evaluated, documented, and reported, whereas a patient is examined, undergoes testing, and is treated. Patients themselves are not diagnosed, but their conditions may be diagnosed. And to avoid dehumanizing usage, it's best to say that cases are managed, patients are cared for or treated. And another example that they give on writing about patients is to refer to them as men or women, boys or girls. Don't say a male or a female. Those should be used as adjectives, not nouns. So here's an example. The study group consisted of 40 male patients and 20 male volunteers. That's one way to write it. Now, they do put in an exception, because with grammar and word usage, you always have exceptions, right? If there is a wide age range of the patients in the study group, you can't say adults or children to refer to the whole group. So you could say the study group consisted of 40 males and 20 females aged birth to 45 years. So now let's practice a little bit. And I have a box of pens. This is just a few little practice stuff. Pens.
Anybody have any pens on there? Need one? Anybody else?
All right. Are there extra handouts? We all need pens? This is good. Further and farther. Make great. That's a good one. Oh my God. I forgot to have you announce about that.
I got about 3 things to tell them.
Let me write myself a reminder, because I think we're going to have extra time at the end of this.
Okay. I thought we've got a couple like upgrades, software upgrades.
Yeah.
Done? Ready?
Ready? Okay. All right, so the first one, how would this variable, what would you say? Affect with an A? Yeah. So it's affect with an A is number one. Okay, number two, wars. What's the first one?
Would affect.
Affect with an A. Mm-hmm. Wars affect everybody in their destructive effects, right, with an E, last for generations. Number three, television has a strong effect, right, on public opinion. Number four, my mood can affect.
It's really A.
Yeah. The patient shows normal affect, right? So that's the weird version of that word, affect, as a noun. Okay, cases and patients, number 6. So you could fix this different ways. 5 of the 7 cases described by Stout and Murray were infants. But what would you all say? Should it be cases or patients? Patients.
What's wrong with cases?
Because it's back to the
case described.
Mm-hmm.
The way I didn't change it because I thought the way you presented it,
Mm-hmm.
the case is described. You don't describe a patient. So I felt comfortable with saying 5 of the 7 cases described.
Mm-hmm.
I honestly do not see anything wrong with it.
Yeah. I think, and again, this is back, let me go back for.
It would have sounded okay also 5 of the 7 patients described as stout or infant.
Mm-hmm.
So obviously that would have read fine, but I was not uncomfortable with 5 of the 7 cases.
Yeah.
Because cases described.
Right. I would say.
A case is an instance of a disease or disorder. So I felt comfortable that a case was being described.
And I guess this is.
I want to describe to you, I want to present to you a case of a 24-year-old patient who came into the emergency room. There's nothing wrong with saying that.
Right.
So if I can present a case, I can describe a case. So I did not change it because I thought it was okay. Now, patient was fine too. But I was not uncomfortable.
Yeah.
We were using a correct term.
The infants is the problem, not the described.
What's that?
Is infants the issue?
The tense.
As opposed to describe
No.
the fact that they were infants?
Meaning, like if you had.
No, it could have been we're women. It could have
Yeah.
said we're women, we're men, we're elderly, you know.
Yeah, and I have to work through this too because this is new to me when I read this in the AMA manual. So I'm trying to figure out how I would apply the AMA words to what you're saying, and because what they would say is that it should be patients, and I'm trying to figure out how to explain why.
If you left it as cases, maybe you have to put Stout and Murray were of infants.
Mm-hmm. That could
5
be.
of 7 cases described as were of infants.
Mm-hmm. Yeah. This is of.
Okay?
All right. Okay, number 7. This study evaluated 24 patients with acute lymphoblastic leukemia. So here their rationale is patients are not evaluated, cases are. So you're evaluating the case. Patients can be evaluated for the possibility that they may have a particular condition.
But even if they.
See where it gets sticky? It is.
What if they were diagnosed after patients? 24 patients diagnosed with
Patients aren't diagnosed.
That's right.
a lot of patients and just put diagnosed.
Yeah.
So we evaluated 24 patients diagnosed with.
Well, you're not. Their condition is diagnosed. See, so this is subtle. This is something that I was not familiar with before I was reading about this. So you're probably having the same reaction I was when I was reading this. So in the previous one with Dr. Quinones.
But again, in these cases, it would have to be this study evaluated 24 cases of acute depression. A case with. A case doesn't have. Case
right, you'd say cases of. That's right.
It would have to be 24 cases of acute depression. And that would be accurate.
Yeah.
But
Okay.
again, I guess I'm from Missouri on this one. I was not comfortable with 24 patients that were in it.
Okay, well, going back to number 6, how about listen to this reasoning and see if this works. Because the word case refers to an instance of a disease or disorder, a case cannot possibly be an infant. The sentence should be rewritten as follows. 5 of the 7 patients described by Stout and Murray were infants. That's the reasoning that the AMA would give. So.
Right.
Okay. All right, number 8. All patients were diagnosed either at birth or during the first 2 months of life. So again, here the reasoning is patients are not diagnosed, their conditions are. So without knowing the context of the sentence above, it's going to be hard to revise that. But one version could be the patient's disease was diagnosed either at the time of their birth or during the first 2 months of their lives. You could revise it that way. So there's some tricky guidance from the AMA style manual on how to refer to patients versus cases. Affect and effect and affect, I think we got a little better. Okay, so now we're...
And their guidelines are based on what set of expertise?
I know that there's a committee formed by people from various journals and various editors and with grammar and style background expertise in that field. I forget her first name. Cheryl Iverson, I can't remember, is the chair of that committee for the AMA style manual, but it's an actual committee. It's not just one person making up the rules. So believe it or not, there are people who enjoy hashing out these guidelines and wording and think that that's great fun.
Yeah, so, I mean, English is, we don't have a Royal Academy of English like Spanish does. English is a dynamic language that changes, right?
Right.
50 years ago, no one would have understood saying, will you please Google that? Now it's completely normal. So we keep changing things. So that's why I'm wondering, as we're changing, I mean,
but there are
a patient comes in and says, Doc, what's my diagnosis? Oh, Doc, will you diagnose me? I mean, probably it's incorrect using these concepts, but it's done every day. So as English keeps evolving and changing, who makes these rules? But we're evolving. This stuff is happening all the time.
So there is a small history of Dr. Thomas Lee, who is now in Frescani, but he was in a meeting in the New England Journal, and they were discussing the words, and he was talking about patient suffering. And the editor there, apparently, she never talked much. He says, patients, they don't suffer. And he looked at the editor and said, what? We are not allowed to use that word when we write research reports. So that word, and in fact, I was looking because I didn't remember the exact name of his opinion. It's published in New England. And it calls the word that shall not be spoken. So just the rules that
To
you
add
have
to
of
that,
things
yeah.
that are in the air or things that are written sometimes affect how we see the
That's
already.
interesting. So I wonder.
Just
So-
that is in 2013. The word that shall not be spoken, and this is in New England by Dr. Lee.
Okay, I'll have to look that up.
There's another one I want to bring up because
For-
I think there was a time that there was a lot of big issues with that one. And that's one that pertains a little bit to the stuff we do every day in research. So you do a study with 15 rats, and at the end of the experiment, the rats are killed, and you look at tissue. And quite often they would say the animals were sacrificed. And apparently that day became a no-no. Because, sacrifice obviously has all the implications that you understand. So, are you familiar with that one?
I'm not familiar with that. When I worked in a lab, we said sacrifice.
Occasional articles where they still are using it, but there are many journals out there saying, no.
Yeah.
Sacrifice is a religious thing, it's a sacrificial thing. The animals were killed.
Interesting. So I guess in the case of not saying the word suffer, you're supposed to describe more specifically, like the patient felt pain or the patient.
Yeah, there was something like that.
Mm-hmm.
I have to. I don't remember exactly, but there was. So the system can suffer, but the patient is not allowed to suffer.
Interesting.
That's one of the things.
So the same thing. Wow.
So this is a 62-year-old man who has been suffering from. So that would be that they would not accept it.
Now, yes, but
now they do.
Now they do. They change it.
Oh.
So that's why he wrote about changing that thing of not being allowed to use the word suffering for the patient.
Huh. That's interesting. Okay. So we talked about this. All right, now we're going to switch gears and talk about writing good titles for your manuscripts. Tom Ansley, I believe I sent you an email, a link on last week's email to his series on scientific writing, and it's fantastic. That article that he wrote about writing titles for your manuscript, that's in that series. He compares writing a title for a manuscript to when you look at it in the process of writing your manuscript. Writing the manuscript is very linear. As you're writing, you might start writing with the methods section, then write your results, then your discussion, then you might write the introduction and the abstract. And it's kind of a linear flow of thought. But writing the title, he says, is where you close the circle, is how you can picture it. And he also says that it's like a billboard. This is your 10 seconds to grab the reader's attention and get them interested in reading your manuscript. So he has some advice for writing titles. First, he says, be concise. Usually you can improve your title by removing some words. Avoid words like a study of, investigation of, development of. And the reason he says that is, why would you be writing a manuscript about it if you didn't study it or develop something or investigate something? What are you writing about after all? So you can just leave that out. The reader assumes you did that. Avoid words like new, improved, novel, sensitive, like a sensitive test or whatever. Because if it wasn't new, improved, or whatever word you're using, then why are you writing about it? Why is the journal accepting your paper? So those are good words you could cross out when you're trying to get rid of something and make your title more concise. And also it gets rid of a little bit of that filler. Second, be clear. Here's an example. H1N1 virus testing on mice using polymerase chain reaction. Okay, what does that mean? That means the mice are doing it. Here's the mouse, he's making the buffer, getting ready to run that gel.
You're right.
So-
That's exactly what it says.
Yeah. Here's a revised version. Polymerase chain reaction testing of mice for the H1N1 virus. Be informative. So I'm going to show you the same title as it changes. And now, I just told you 2 slides ago to be concise and cut words out, but it's also important to know sometimes you need more words to get your message across. Statins and cholesterol. Now we have more information. Effect of statins on serum cholesterol. Reduction of serum cholesterol with statin therapy. So we're telling more of a story. And now we have a good title that tells you something. Statin therapy reduces serum cholesterol in patients with cardiovascular disease. So we've added words, but it's still rather concise, and it tells you what the manuscript is about. Fourth, use keywords and terms wisely. Here's an example of how word order can change the emphasis in a sentence or in a title. Blood stored on ice yields increased HLA match percentages for bone marrow donors. So what are we emphasizing in this title?
Blood on
Stored on ice, right. So we're focusing on blood processing and storage. I guess if you were sending this to, I don't know, a journal that dealt with blood processing and storage, that would be a good way to phrase the title if that's what your manuscript was about. Here's a different way to write it. The same title, but just moved around a little bit. Increased bone marrow donor HLA match percentages for blood stored on ice. So now what are we focusing on?
Bone marrow match.
Yeah, bone marrow HLA matching. So let's try and improve these titles. The first one, development and evaluation of a new ELISA for the improved detection of lupus-specific anti-nuclear antibodies. And there's no specific correct way to do it. I do have a revised version, but there are many ways you could fix this. Any suggestions?
It's very long.
What's that?
It's very long.
Mm-hmm. You could cut it down. There are certain words you could knock out, right?
New.
Development of an improved
Yeah.
detection.
Yeah. So this is one way you could fix it. ELISA with improved detection of lupus-specific anti-nuclear antibodies.
I don't like it.
Why is new such a bad word?
Well, actually, I would rather stay with the old.
Because if you're trying to cut down, you could say new, but the assumption is that if you're publishing something like a new technique or something, it is new, or you wouldn't be publishing it, right?
Yeah, but what we see, like you can see, is improved detection of lupus-specific anti-nuclear antibodies using like third-generation ELISA or something like that. They
Yeah.
call it something. We have seen that or something like that.
I would like that. This one, I don't like it at all.
You don't like it?
Oh, no.
Okay.
This one, the first one is not exactly the greatest, but at least it gives me the message of what the paper is about.
Mm-hmm.
This one, I struggle with what's this paper about.
Okay.
The second one, I don't like at all.
Okay. What about this one? How could you fix that? Reduction of viral load in blood after, albuminavir treatment of HIV-infected patients.
I mean, there's no point in talking about reduction of viral load because that's the whole point of giving albuminavir. So you can just say albuminavir.
No,
That's the whole point.
You don't know what
if anyone, you don't need HIV infected patients.
Who else is going to receive albuminavir?
Why you can do that?
You can just say Albenavir treatment for HIV.
Albenavir treatment.
You don't know what Albenavir is doing.
Reduction of viral
You can still
Just
go in there.
expect that's very obvious.
Albenavir treatment of HIV
No, it could be.
improves the
Reduces viral.
or reduces viral load.
Albenavir treatment.
How about reduction of HIV viral load?
Albenavir reduces
in
viral load.
In HIV.
You don't have any HIV stuff.
So here's the one way to rewrite it. HIV viral load reduction with Albenavir treatment.
Okay. Yeah.
So it's short,
Yeah, yeah.
it's clear.
Yeah.
Yeah.
That's okay.
Okay. All right, we're going to switch gears one more time onto the next topic, which is plagiarism. And we're going to start with some music, just to get you in the mood to think about plagiarism. Go back around. Okay. Could anyone tell what he said at the end? I can't.
Copy that.
So that was from, if any of you have young kids in your life, you might be familiar with Sandra Boynton. She has a series of little books for babies and young children, and she is amazingly a music producer, and she can bring these high, very popular country music singers, and she produces albums for children. So that was off a children's album, but I thought Copycat is a perfect song for plagiarism. So plagiarism, what is it? It's the practice of taking someone else's work or ideas and passing them off as one's own. You know that. Most people who plagiarize don't mean to. They just get themselves into a bind. Here are some good habits to avoid temptation to plagiarize. Trying not to procrastinate, understanding your material well, and being organized. If you take good notes, I would say number 3 is really important, because if you take good notes as your putting together your thoughts for a manuscript, you're less likely to think something you came across was your own idea. I'm sure we've all been in a situation where you've been reading so much that you think something is your own idea you came up with. Now, I'm not going to talk about regular just cut and paste plagiarism. You all know that. I'm going to talk about a few different types that people don't think about very much. Mosaic plagiarism is a term used for if you take bits and pieces from one or multiple sources and you're just changing words here and there and not properly citing the source. Another type is self-plagiarism, and this one is actually debated quite a lot, but it's still plagiarism, and all the International Committee of Medical Journal Editors and Committee on Publication Ethics all say that you cannot present your own previously published work as if it were new. So even taking little chunks of writing from a previous manuscript, you can't do that. And why? I mean, it's your own words, right? How can you be plagiarizing against yourself? Well, you don't have the copyright. If it's been published, the publisher has the copyright. So you cannot just take something, bits and pieces from your previously published works and publish it in something new. Another one, which I had never heard of before, at least not called as plagiarism, but apparently it is secondary source plagiarism, where let's say you use a secondary source, like you're reading a meta-study, or I guess a review article would be another example of this, and you only cite the primary sources that were referenced in that secondary source. And where does that become a problem? Well, what you're doing is you're not attributing the work of the authors of the secondary source, because they did all that research. They're the ones who went to the primary literature and read those papers, and they decided which papers to cite in their review article or their study, right? And so that is...
I'm confused on this one.
Okay.
Yeah.
So let's say we could use a meta-study, or we could use, I think a review article would be another good example of that. And you know how they have a list of references that they cite, and within the text they'll refer to this or that paper. If you then turn around and you're writing a paper and you read a review article for some background information, and all you do is directly take the sources that the review article used, and you don't do any original research of your own looking at the primary sources, you're just looking at the sources that they listed.
I have the review article.
Mm-hmm.
The article quotes a study by Smith et al. That is very specific to what I'm doing.
Right.
Okay. So I now go in and click on that, because electronically you can click on that, and I then go to this Smith et al. Study and review it.
Right.
There's nothing wrong with them going straight forward to Smith and saying, the study by Smith and said the authors found blah blah blah.
Right.
That would be okay.
Right.
But if I only quoting what the review article said about what Smith study did, and I almost copy and pasted, with a minor change, then that would be plagiarism.
Right, and I think this, I mean,
that's the subtle differences.
There's nothing
But
wrong.
You actually click that article, go in it, review it yourself, and then you want to say, Smith and Associates found so-and-so in their study of X number of patients, that'd be fine. But if the review article was saying Smith and so-and-so found so-and-so, and you kind of use the same concept and throw it into your discussion, never go to the original source, that would then be it's a subtle thing.
You will use you will cite the review also.
Yes.
Both.
Well, but it may not make sense to quote a review when you're making a statement about what Smith and Associates found. It would be funny to say, because actually we were taught the opposite.
Yeah.
If I write a sentence in the discussion saying Smith and Associates in their study of 1,500 patients with so-and-so coma found A, B, C, and I quote the review paper without ever going to the source, that was a number.
Yeah.
That was considered a number.
Yeah. one of the things, and this maybe is not true, is the way I think. If it's something that I do my research and then they find, and I wasn't able to find it, and it's very specific, like a very old paper, and when that review was able to find it, like I will put the review there and say I will put the references for the review also. But it's I understand what you're saying. Is like if you're reading of a specific thing in a review and you go and investigate, research, summarize all your findings, and you have a original conclusion, that's good. But also, if it's very good, very difficult to find because of the way the way it's written, I will.
But then you have to be careful how you write.
Yeah.
Then you want to say in the review, in a review of this topic by blah blah blah, you know.
Right.
Then
Yeah.
continue.
Or,
I mean, the point is how you phrase it. Because if you phrase specifically as Mr. Associates found so and so, and all you quote is a review paper, that would not be kosher.
No. That's that. I understand.
And the point is, you should always hit and go to that source.
That's for sure.
I have a question on the first one.
Sure.
The mosaic plagiarism. So a lot of times what I see is, especially from, like, probably is a little bit of, I guess. But anyways, what if they actually cite the source?
That's fine.
I'm sorry, what was that, Michael?
A lot of times, actually, you'll be reading, oftentimes it's from the person who's written a lot on the subject, and it may be a little bit of self-plagiarism, but you'll see, even from the original source, you'll see, statements that carry on through the publications, but they cite a source. So if you're taking different things and putting it together, but you're citing a source, but it's not really, you can construct whole paragraphs doing that.
Yeah, that's fine. And if you take a whole chunk of verbatim text, obviously you want to put quotation marks.
Use a good quotation.
But if, let's say you're just taking ideas and words here and there from multiple sources, as long as you're citing it, properly citing, that's fine. It's not plagiarism. So that's okay. Just a quick note, if you do need to reprint figures of, from your previous publications, try and request that early. There is a copyright clearance center that a lot of the journals use, but the specific journal where you originally published will tell you how to request a reprint. A lot of times they send you to this website.
What does that mean? Because I'm not really sure about that. Like, that means if you want to put it in a book, like let's say
right,
you wrote a paper and then you'd like to use that figure in a book.
Or a review article that you are writing about. Let's say you wrote an original research article and you had such and such figure and you want to reuse it in a review article in a different publication. You can do that if you get permission. So. A quick note on plagiarism detection software, which a lot of journals are using now. They do not automatically detect plagiarism. What they find is text-to-text match. They can be fine-tuned to find paraphrasing as well. But they do not have the human element, so it's up to the editors to decide is this plagiarism. All they do is pull matches.
I'll tell you a story. This happened over 10 years ago. So I'm reviewing a paper that was written by a group in Europe, okay? A country that currently is having a little bit of financial problems. And as I read the paper, I said, this sounds very familiar. So I pulled a paper I had written 5 years earlier, and I'm kidding you not. From introduction to method to resource and discussion, it was my paper.
But in a different
That is the ultimate that you could think of plagiarism.
Like everything?
Everything.
Wow.
I mean, minor prepositions.
But did they put you on the references or not? Maybe there was a small quote in the
No reference whatsoever. It also to be one of the very few papers in my life that I got accepted without second revisions, and I just couldn't believe it. I obviously notified immediately the journal, and they went ahead and notified the university where this person was coming from, and hoping they got fired.
Wow.
That's the ultimate example that I could tell you.
Okay, I think our time's about up, but Lene needs to say a few words real
I
quickly.
just want a quick announcement about Biomed Central. Biomed Central, open access journals. If you publish in an open access journal, you retain the copyright yourself as an author. Always good. And there's 278 journals in Biomed Central, and they have by subject, I'm just going to give you a couple of the names. Clinical hypertension, cardiovascular ultrasound, BCM, cardiovascular disorders, biomarker research, Journal of Cardiothoracic Surgery, and so on. All of those now, we have membership to Biomed Central. So if you publish in there, we have an institutional membership number, you get a discount. A pretty significant one. So call, or I can give it to the department, so that you have it, and when you use it for publication. About four people have published in the last month in one of those journals since we've joined, so it makes a difference.
Thank you.
All right, thanks.
Thank you.